Okay, you guys, I am here with Dr. Lori Stetler from the Dallas Center for Dermatology and Aesthetics, and we are doing a little Botox touch-up on me. I've actually been using Botox since I was in my 30s, and I feel like it is a key ingredient in my anti-aging skincare routine. So I'm so glad to have you.
Yay! We're glad you're here. Of all the things I do all day long, Botox is definitely the best. Stop the aging in its tracks. Highly recommend. So basically what we're going to do is any area that's caused, any wrinkle that's caused by muscle action, we're going to treat these areas. So we've already touched up her crow's feet, we've done her frown, we've done a little bit on what we call these bunny creases. We're going to finish off with her forehead, and then we're going to do a little bit on these neck bands. So basically we're going to relax these areas. She's going to get lift, she's going to get softening and wrinkle reduction.
Okay, so you just saw a video of me having a Botox treatment with Dr. Lori Stetler from the Dallas Center of Dermatology and Aesthetics. I'm so thankful that she is my provider. And now we're going to dive into all things Botox, answer all your questions, and just learn everything that you ever wanted to know. So first of all, let me tell you, I started having Botox in my 30s because I had migraines. And so I had a couple injections in here as migraine treatment. And my kids said, Mom, what is going on? You don't look as mad anymore, because I couldn't frown anymore.
Right.
So I thought, well, this is a good thing that my kids think I'm happier and not as angry at them. And so for me, it was the gateway. Since my 30s, it has just become a really standard part of my anti-aging routine. And I think aside from probably retinols, it's been the best thing that I've done for myself in terms of anti-aging. So every 3 to 4 months, I come in and we touch up what needs to be touched up, and I'm so grateful for it. So let's dive in and let everybody just know more about Botox, because there are so many questions out there. Okay, first of all, why don't you just tell us what exactly is Botox, medically speaking, and how is it typically used?
Okay, and I'll say first off, of all the things I do in my practice all day long, Botox is the best anti-aging treatment. So it is tried and true and consistently produces good results. So that's number one.
I feel proud.
Yeah, absolutely. And you got to start it so early, which is fabulous. And it really stops aging in its tracks. It makes a huge difference. So basically what Botox is in a nutshell, it is a protein derivative from a bacterium, botulism toxin. And what we're doing, you cannot get botulism from this, by the way. We take the little protein, we're sticking teeny tiny amounts in the muscle groups that we want to treat. And basically what it does is put in a roadblock. So it's taken up in the nerve terminal. Say for instance, your brain says frown, it doesn't get a signal, so the muscle stays relaxed, okay? And if you think about it, if all day long, a strong muscle like a frown, crow's feet, if they're not creasing constantly, over time, those lines just start to soften. So super safe. It's been around a long time. It's been around in aesthetic medicine for over 20 years now. It's been around in medicine just in general for much more than that. So safe and effective, tried and true.
Love that. Okay, so I did start for medical reasons. What are some of the other medical reasons that people might
So probably the most common ones you've heard of, migraines for sure. We use it medically for patients with hyperhidrosis, so sweating. So a lot of, we can do palms and soles. We do a lot of underarm sweating, so from a medical standpoint. Bladder spasm, back spasm, kids with cerebral palsy that are spastic to relax muscle. So those would be some of the most common medical ones. And I think they're always coming up with new things that it can do. So it's pretty magical.
That's awesome. Okay, so then when we're talking about cosmetic application, what are the most typical areas that you see?
So most common areas would be your upper face. So it's going to be your frown lines, your forehead lines, and your crow's feet. And then probably less or ones that we do commonly but patients may know less about. We do your little bunny creases. So when you smile really big and we get these little horizontal lines going across, it can prevent those. Around the mouth, you have to be careful around the mouth because we have to function there, right? So you can't relax those muscles completely. So you can use a little bit in the little vertical lip lines. There's a muscle that pulls all of us down here, causing a mouth frown. you can put a little bit at the base of that to lift that. And then if you get the little neck bands, you can actually put it in there to lift as well. So there's some tricky, little nuances. Masseters, common. So patients who get TMJ, or so this would probably fall more under a medical category, but TMJ, and you can actually feel, like when you grit your teeth, you can feel like rock hard muscles because they clench all night. Botox works great for that. And what happens is, especially for women, sometimes they get a squared off, more masculine looking face because of the muscle buildup. So you actually kind of create a heart-shaped face. So that may be one not everybody knows about.
That's a great one. I didn't know anything about that. Okay, so when people hear Botox, I think they become concerned about potential side effects. So what are the ones you see most commonly? What are the ones that people might want to be concerned about?
Got it. So most common side effects are going to be related to the injection site. So small pinprick, usually a little red mark, potentially a little bruise, maybe a little swelling. I think and those usually resolve honestly within hours to days at most. If someone has if they're on a blood thinner or they're on, a bunch of aspirin, things like that, they may have a little higher potential for bruising. So if we have the convenience to be able to stop that, we try to stop those things ahead of time. The one probably that gets people worry about eye droop. Statistically, it's under 1% of patients that get that, so it's not very common. Where you run the risk mostly is when we treat the forehead. It's a big rectangular muscle, so when we relax that, you can get a little bit, you don't get a lift there, you get a little bit of a drop. So if you have somebody who has a very low set brow, or they have a lot of hooding or excess skin on the upper lids, those patients may have a little bit more risk of noticing a little bit of droopiness. The beauty of Botox is it is all reversible. So if for some reason you did do it and you had something that you didn't like, it's going to go away. So it's kind of a built-in safety mechanism.
So we didn't catch this on camera, but when you were doing me, I kept saying, lift everything,
right.
Lift. Is it possible to do a little bit right at the edges here to lift everything?
So
as soon as I was yelling lift, that's what you started doing.
Right. So when you hear the term Botox brow lift, where that comes in, these muscles here naturally push us down. So when we treat the frown, we lift, and crow's feet bring us in, right? Bring us down. So when you lift here and go up to the tail of the brow, that's where you get your lift. Again, where you have to be careful is that forehead that can tend to get a little droopy. Not so much in a younger patient, but as we get a little bit older, like I can't do the same dose in my forehead as I did 20 years ago. I have to go a little bit lighter because I notice when I go to do my eyeshadow, it's like, oop, gotta lift a little more. So, and we have to titrate it to each patient. And so that's the importance of going to somebody skilled who knows anatomy to just avoid any of those,
I was just going to say that. I'm so grateful because you do so much of it. You're so experienced, and I feel like that's you're not only paying for the Botox, you're really paying for the excellence of the provider and the experience of the provider who's doing it.
Agreed.
So, okay, how long does it last? And let's talk about cost, because I know that's something people are concerned about.
So national average 4 months. That may be 3 months for somebody, 5 months for somebody else. It can vary by location. I can tell you I have to do my crow's feet a little more often than I do my frown. And so some people just genetically may be stronger in one area than the other, so that's not uncommon. Cost-wise, it will vary, and it's either going to be charged by the unit. So if you're kind of shopping for, where you're going to get your Botox done, or charged by the area. And so the difference with the two, so we charge by the area, and so we guarantee our work, and so for 2 to 4 weeks after the treatment, you can come in for a free touch-up if we need to add a little bit more. If you go to someone who charges by the unit, they're usually going to charge you a unit price to start with, but if you have to go back and add more, they're going to charge you the same unit price to add more units. So it's hard to compare prices when you're shopping around because you're not always comparing apples to apples.
Well, and like I said, you're paying for the provider and
right.
their expertise
right.
too, and their experience. I really believe that. So do you ever see people who it doesn't take as well on the driver's side?
So sometimes, because we have more sun damage and we have more loss of elasticity, sometimes that side is also a sleep side. So if you have somebody who always sleeps on one side, they tend to crease a little heavier. So sometimes you do have one side that you may have to do a little bit higher dosing, or sometimes you have to go back and tweak and add just a little bit more there. Not always though.
I always feel like mine's because I'm left-handed, so I always
right.
have more lines over here. I don't know.
Yeah, but there is definitely something to the car window.
Okay. So what about Dysport? Because, did I say that right?
Yes.
Because I know that it's a Botox alternative. How is it different, and would you use it on different patients than you would Botox, or how do you decide that?
So Dysport is another neurotoxin, Botox competitor. It was the second one that was FDA approved. Been around, safe. I think you would never know if, in terms of the injection is the same. You would never know by me doing it which one I was doing. The difference is it acts at a different receptor, so it's taken up in a different nerve receptor. The result really is the same. Some people may feel like Dysport may start or be the effect may happen a little quicker. Personally, for me, that doesn't seem to make a huge difference. It does have the potential to spread a little bit more. So if you have an area where, say for instance, if you're treating underarm sweating, you may want it to spread all over to get better coverage. So sometimes I will use it there. You may not want to use it into an area that you don't want it to spread. So say an upper lip where you're using just a tiny amount and you don't want that going everywhere, that may not be my first choice. I have patients that I treat Botox in one area and Dysport in another. And I think one of your questions to me was, how would you choose? So I would say Botox, because it's been around so long and it's pretty iconic. Most people come in asking for it by name. You occasionally get somebody who's like, Botox just isn't lasting as long for me anymore, so we'll make a switch. Or like I said, sometimes it's just if they had an experience with one or the other and weren't happy with it, then sometimes we'll try the other. So lots of reasons to switch it up. And here's the thing, you can always switch. If you don't like it, you can always go back.
It's
so
temporary.
It's pretty easy.
That's nice that it's so temporary. Okay, so you hear a lot about topical products on the market, and I know they can say anything they want, but saying that, you know, this is like topical Botox and this will freeze your lines, and is there really such a thing? I mean,
so there is no topical Botox. Here's a new one. And so think of topical products as pairing with your neurotoxin. There are studies ongoing actually to see if you can use Botox topically. The problem is you have to get to muscle. So when you put it on the top of the skin, it's got a long way to go to get to that effect. So far nothing's really panned out in clinical trials, but I think there are plenty of people looking for that. For certain areas maybe, like again, underarm sweating is an area where you might want, if you could put it in a cream and just spread it all over and it worked, that would be fabulous. So there are some products on the market that pair well with them. So this is a new one that's come out by a company called Revision. It's called Revox. And it is a peptide, so it's a collagen builder. And when you pair it with this, you also get some muscle relaxation. So between the Botox, so you know, if you're using say Botox on the crow's feet and pair it with this, you can get some collagen building, smoothing of the, you know, the skin, the crepiness, those types of things, and you get the muscle relaxation with the Botox as well.
Okay,
so
I'll just take that.
Okay, yeah, nice little adjunct.
No.
Right. Right.
Okay, so what is the average age for Botox patients, maybe for initial use? And I hear crazy stories about like teenagers coming to use it and girls in their 20s. When would you know that it's the right time? Talk to us about the age.
So great
situation.
question. So I would say average age mid 30s, 35 probably being the average. However, I will say patients are starting younger, and the millennial population likes to do this prejuvenation baby Botox. Here's my rule. You don't want to start too early, because we do know over time sometimes it may become less effective after you've done it for a number of years. So you don't want to start in your 20s and then you need it in your 40s. So my rule of thumb is you have to have an etched in line starting to form at rest. There's no use coming in 10 years before you need it. So if you're looking at a mirror and you're looking at your face and you start to see a little etched in line that's not going away when you frown, that's the time to start, because that's when you can reverse it. Now, everybody's different. I have most of my patients are in their 30s, but every now and then you'll get a 20-year-old who just has a really deep line genetically on their forehead. Well, that's appropriate then to treat that. So I don't think you need to start well in advance. So sometimes I have to talk younger patients like, let's start skincare, and then as you age, then we can start doing some of the other procedures. Or we've got other, you know, light fraxels, things like that that might be more appropriate.
So is there an average age when people come to you to get their first treatment?
I still think it's 35. I still think
Okay.
mid-30s. Yeah, by far.
Okay. Again, I'm feeling pretty good. That's about what
Yeah,
I started.
and I was gonna say you started and you're lucky that we had it then, right?
Yeah, exactly.
I know you look at our mothers, grandmothers, or whatever who didn't have the luxury of
Yeah.
it. So it definitely, we're gonna look better along the way. We're
That's
still
right.
gonna age, but we're gonna look better along the way.
Great. Okay, so when you think about age, do you have like an age limit that you're like, oh, it's just a little late for you?
So another great question. So in the clinical trials, they study patients up to 65.
Okay.
My oldest patient is 92. So she still gets her Botox, she still gets her filler, she's active, she travels, she's amazingly with it. So there is no like, oh, sorry, you turned 65, you can't get it anymore. No, you can continue as long as you want and as long as you're, and I'm like, stay in the game.
Yes,
Right? Don't
I
give
love
up.
that. Oh,
Right?
That's a great way to end.
Yes.
Okay, thank you so much
You're
for this time.
welcome.
Thank you for answering all our questions. Thank you for doing my Botox. I'm so grateful. Thanks, you guys, for watching.